All right, my name is Taryn, and this is the recording response for the Unit 8 discussion on reality theory with Marcus Miller. So the first response, it's asking, what techniques do you think are most important in building a relationship with Marcus while helping him to understand the basic tenets of reality therapy? Some of the things that I took note of were just being non-judgmental, showing empathy, being genuine, and active listening. Just some of those key components that I think it's important to start developing that therapeutic relationship. Also, one thing that I noted was reframing the language so that the individual is taking more responsibility. One thing that really stood out for me when I was reading over this was when the therapist, reframed the language. For example, he said, how do you hear these two things differently? One is, I have writer's block, compared to I'm choosing not to write right now. And I think just reframing that language within reality therapy and making, helping the individual to take more responsibility is like a key point to that. Because then, he thought about it and was like, well, in the first situation, it's not my fault at all. And it's easier to blame other people or other things for the situation. Like, I have writer's block, instead of I'm choosing not to write right now. So just reframing that language, because, it talked about how individuals utilizing reality therapy can learn new ways of choosing through the development of relationships that are accepting, loving, and caring. And so the therapist can provide, those important parts of the relationship, of building the relationship with the client, and utilizing reality therapy with them. So the next prompt is asking, if I were going to continue as Marcus's reality therapist, how might I use the WDEP system to support him in exploring and creating a plan to strengthen his relationships? So in the first part of this, the W, it's discussing the wants. Some things I gathered from reading this situation with Marcus is that he wants to feel more independent in his life. He wants to be able to pass his comp exams. He wants to be able to have a good relationship with Rob, which is his partner. And he talked about some of his other more long-term wants and goals. Like he would like to have a house with his partner, Rob, have children, become a university teacher, and have a life outside of his career. So those are some of those things that you can start exploring and discussing with him. First, you have to, identify what those wants and needs are. Wanting to feel more independent is a big part of it, but also wanting to feel that love and belongingness with other significant relationships in his life is also important. So the next part is the D is direction. So what steps is he taking in order to get those wants met? Previously, like, he realized that his way for meeting his need for love and belonging was to let others take care of him. He realized that he is being very dependent in his relationship with Rob, and that dependency is actually pushing Rob away. He's trying to get his need met for love and belonging by being more dependent and having Rob take care of him. But now that Rob's gone, he's unable to attend to him in that way. So he's realizing, though, that being more dependent on him is actually pushing him away when he's just trying to get his needs met for the love and belonging. He does start taking other steps to get his needs met. So his wants met, wanting to be more independent. Marcus started utilizing some of his own methods, like getting the app with the timer to help him, focus and work on writing his papers. He also took steps to, bring himself to therapy and not relying or depending on his sister to bring him there. Let's see. The next part of it is the self-evaluation. So, he's starting to realize that he is making himself, depressed by, not doing anything, sitting on his butt, constantly thinking about Rob and Rob's view of their relationship. Also, like, leaning on his sister to take care of him. Marcus is realizing that he has to learn to take care of himself, and in order to fulfill that need of independence, because, he did make a note that if I'm relying on other people to do this, then I can't take all the credit for the outcome of it. He wants it to feel like it's coming from himself. So, he takes himself to therapy, and he's starting writing on his own time to realize his own dreams and goals without relying on other people, because he does have that need to feel independent, to feel, I guess, self-empowered, to feel like it's coming from himself and that he's not relying on other people. And then I guess the last part is the plan. Let me just look really quickly at something. Okay, so developing a plan with him, it's kind of the last part of that WDEP system. The client, Marcus, has already showed he's been able to evaluate some things, and he's already made some of his own plans. So just working with him on furthering those plans. So, ways in which that are empowering him to take responsibility. So continuing on his path to get his competency done, because that's like his most immediate concern that he can work on, is getting those comps done in the next 5 weeks. So just making sure that he has a continuous plan for meeting those goals. And then also, with his relationship with Rob, maybe you could talk to him about, talking to Rob about some of these things, and being able to express, maybe ways in which he has gotten his needs met for love and belonging in the past, and how he's realizing that that might not always be the healthiest or the best way to do that. So even talking with a therapist about different ways to meet those needs within his relationship with Rob, which can start in the therapeutic relationship. That can start there. Or, you can discuss ways in which he can get those needs met in a healthier way, instead of automatically going to, well, he must not care about me the same, or he must care way more about his career than he does our relationship. But maybe just helping him understand or find, some kind of balance, or like that those two aren't mutually exclusive, that Rob can, you know, feel like his career is really important, just like Marcus feels like his career is important to him, but that doesn't have to be mutually exclusive for his, love for Marcus, or vice versa. So just helping him create a plan to like meet some of his most immediate goals, and then also helping him to create a plan to improve his relationships, his relationship with Rob, perhaps his relationship with his sister and his parents, to help him find other ways to get those needs met that aren't necessarily putting him in the position of being the dependent one or the helpless one or things like that. Let's see. The next question is asking, what multicultural issues does the therapist need to attend to? So one of the things I thought about is that it mentioned that Marcus was the youngest child in his family. And so he's used to, he realized from a very early age that people just took care of him. And that's how he developed his getting the need met for his love and belonging, was allowing people to take care of him. And since that has kind of been a part of his family, that's transferred over into other significant relationships in his life. So just keeping that in mind as far as, where that's developed, where that's coming from, and helping him navigate those relationships, and being able to find, like I mentioned earlier, new ways of getting the need met for that love and belonging in other healthier ways. That doesn't put him in the position of being the one that's always needing to be cared for, or that he can't do things on his own. Another thing that I thought about is I guess just like checking your judgments at the door. I mean, this kind of, it's not really an issue for me, but I guess it could come up. Like, Marcus does have a significant other who is Rob. So I guess just making sure that like you check your own judgments at the door, because like reality, so this comes into play because reality therapy encourages clients to focus on inner control as opposed to the thoughts and actions of others. And I noticed like Marcus spends a lot of effort and time focusing on like Rob's thoughts, like what he's thinking about their relationship, and things like that. So I think it's just to be cautious when working with him, that there might need to be continual work on, focusing Mark on thinking about himself and those inner thoughts as opposed to like what Rob's thinking, because I think that does take up a lot of his thoughts. So obviously being non-judgmental towards his relationship in the first place, and then also helping him focus on the inner, control, his thoughts and his inner control, how he can control and be in control of his actions, thoughts, behaviors, instead of putting those on other people, especially like Rob. That's kind of the major things I thought about when working with Marcus. I'm sure that there are some other issues that maybe could be brought up in therapy. But that's just a few things that I thought about. The last question is asking if I were applying REBT with Marcus instead of reality therapy, what would be two major differences in the delivery of counseling? So as I was reading about both of these, there are a lot of similar techniques that are used within these two styles of counseling. One of the differences in the delivery would be, if I were using the rational emotive behavior therapy, would be teaching the client about the ABCs and how our beliefs about certain events or situations really cause like the emotional distress regarding that situation. So it's a focus on the beliefs about that situation. So for example, if I was working with Marcus, so there's like two differences. One is discussing the ABCs and applying it to Marcus, and also challenging or confronting some of those like cognitive distortions that Marcus has. So they kind of play into each other. But so the first one would be, so here's an example. The activating event, if I'm going over the ABCs with Marcus, an activating event could be like the fact that Rob is away. Like Rob is not here right now. So that's an activating event for him because Marcus would really like for him to be there, but he's not. For his job, he's on the other side of the world, basically. So Marcus's belief, one of his beliefs because of this activating event that Rob is away is that I cannot think straight while Rob is away. So the consequence of that belief is that he's not being productive. He's lethargic. He's, depressing himself. He is, lying around, not getting things done. So he's not actually able to work on some of his other goals that he has, like his comp exams, and he's relying on other people like his sister. That's the consequence of his belief that, he can't even think straight while Rob is away. So a second piece of the difference is more that challenging some of these cognitive distortions. So it's cognitive disputation. So actually talking about this with Marcus in a session. So, challenging him by saying something along the lines of, how has thinking this way been productive? And it really alluded to the fact that like he's able to realize that he hasn't been productive, thinking these things, I can't even think straight without Rob, that's, giving more power and control to Rob without taking any of that himself. So focusing again inward, which is combining kind of both. But back to the cognitive disputation, he's realized that this way of thinking has not been productive, that he needs others to do for him during this time, but really he's wanting to do for himself. And he starts to find ways to be productive on his own while Rob is away. So bringing himself to therapy, doing the time sessions with his writing and actually being productive. So even the act of doing something different, he's actually challenging. He's learning to do things while Rob is away, and he's actually challenging those cognitive distortions, like that cognitive distortion, the belief that he cannot think straight while Rob is away, aka he can't do anything while Rob is away. Like he's seeing that isn't true. He can do things while Rob is away. So he's actually challenging that belief through, behavioral things and stuff like that. But even just in session, talking to him and challenging those cognitive distortions, or they could be emotional or behavioral, but talking to him, how is this productive to, how has this way of thinking been productive? I think that Marcus is able to, realize that it hasn't. Some of the ways that he's been thinking has not been productive. So the ABCs and then challenging those cognitive distortions in sessions are a little different than what I would do with a reality therapy, even though both reality and REBT have some very similar techniques when counseling. That is all I have for now, and I look forward to hearing feedback. Thank you.